Thank you for joining us today. Thank you, everybody, for joining us today. Thank you for the caring about Montanans. I'm grateful that the speakers jumped in at the last minute at the opportunity to talk about their experiences with Medicaid for themselves and their family members. I am also very grateful to elected officials from all over the state, the county commissioners, who had the great idea of joining forces with us to stand up for Montanans. Thank you, everyone. Last year, a company called Guidehouse was hired by the state of Montana to conduct a study. The study cost millions of dollars. The purpose of the study was to identify the cost of doing business in Montana as a Medicaid provider. We all waited with bated breath for the outcome. The study has provided us with the data proving that the state of Montana is underpaying the businesses who provide services and supports for Montanans who have Medicaid. These providers have decades of experience and are committed to the people who have disabilities, cradle to grave, children, adults, and the elderly. The Appropriations Subcommittee has started the job, and it's time to finish it. No provider or worker should be expected to sacrifice their own economic well-being and that of their families for doing what we need, caring for our loved ones, caring for Montanans now more than ever. Also, we have a bill, House Bill 627. House Bill 627 adjusts the Medicaid provider rates identified by the benchmark study. It gets us all the way there. We have the money, we have the need. Let's solve this tragic and unnecessary problem. It is our moral obligation to Montana's senior citizens. It is our moral obligation to people who have disabilities and people who are suffering from mental illness. Like I said, we have the money, billions of dollars in surplus. We will now hear from Montanans who have direct experience with Medicaid, and after that, we will open it up to questions from the press. I really encourage you to stick around and visit with the county commissioners. They're county commissioners from all over the state. It's awesome, and talk to the families, hear from them firsthand. And with that, we'll start with Margie MacDonald. Margie MacDonald is a board member of Big Sky 55 Plus. Thank you.
Thank you, Representative Caferro. Big Sky 55 Plus is a group of Montanans 55 and older who are working to make our state a better place for all generations, young and old, because we are all connected. Connected is what this important bill that the representative talked about is all about. Our long-term care facilities are an essential and integral part of our communities, especially across rural Montana. It is not like when the doors close on one of these homes, the residents and their families can go down the street and find another long-term care facility that A, has the capacity to provide skilled nursing care, and B, accepts the Medicaid patients. In fact, these good folks who have raised us, who have built our towns, our schools, our roads and bridges, and who have handed to us a pretty darn good state to live in, a great state, being shuffled down the road hundreds of miles away from home and family and friends. This is not acceptable. Step one in turning this around is accepting the results of the $2.7 million Guidehouse study recommendations for the minimum reimbursement rate to cover the actual costs, which is Senate Representative Caferro's bill. Is it 627? I thought it was 649.
I get my numbers.
Well, 627. Okay. Big Sky 55 looks forward in working with lawmakers to make sure this happens. And thank you, everyone, for being here.
I apologize if I have talked about the wrong number for the bill. I never remember numbers, but it's being heard in House Human Services tomorrow at 3, and I'm the bill sponsor. Room 152. Our second speaker is a county commissioner, and before I announce him, I'd like to say thank you to County Commissioner Mary Armstrong from Valley County, and thank you to County Commissioner Zach Brown from Gallatin for a wonderful op-ed that they wrote. It really speaks to the impacts that all the counties feel when the state doesn't fulfill their obligation to the families. We have copies of the op-ed on this table right here. Our next speaker is County Commissioner Zach Brown from Gallatin County.
Thank you, Representative. I think I was tapped to speak because Gallatin County has had a recent ballot issue that deals with this problem, and we have the dubious honor of owning and staffing and operating the last standing skilled care facility in Gallatin County, the second most populated county in Montana, with 120,000 residents, has exactly one skilled care facility licensed for 69 Medicaid beds. The senior care economy is in shambles, and we have to fix it. And this bill is part of that solution. And I think I speak for rural and urban commissioners from across the state who signed on to our op-ed, who have urged our MACO staff to prioritize this issue. All of our communities have elders who deserve quality and competent and stable care options as close to their community and their loved ones as possible. This care economy is truly struggling and broken, and we need to fix it. The state of Montana recognizes the high cost of care by funding their own care at the state hospital at over $800 a day for dementia patients. And our neighbor to the east, North Dakota, funds their nursing homes over $500 a day for a bed to take care of a Medicaid nursing home patient. This should not be a partisan issue. Our seniors deserve high quality care, and there's an opportunity in this session for the legislature to show real leadership where it is desperately needed. Because our facilities are going out of business, whether they're privately owned and for-profit or nonprofit facilities or county-owned. They're all struggling and they're all bleeding financially, and we need the state to step up. So thank you to Representative Caferro. Also, thank you to Senator Beard, who brought a policy bill last week on the Senate side that starts to incorporate some of the components of the Guidehouse study into a sustained process that would create a policy framework that would help the state keep up with this issue rather than just having one-time only funding discussions. So thank you, and thank you, Representative Caferro.
Our next speaker, thank you, by the way, thank you to the two previous speakers. Our next speaker is Casey Molloy. She is the sister and guardian for her sister, Peggy Chilton, who is physically and mentally handicapped.
Thank you, Mary. First, I want to say thank you to Mary. She's a rock star. I think we should all thank her for her hard work. I'm here to tell a story, and the story is about my sister, Peggy. Peggy is the second of 4 children born in 1950 to my parents here in Helena. When Peggy early on was diagnosed with severe mental and physical disabilities, my parents were faced with the decision of what to do next. In those days, institutionalizing your children was the way to go. There were a few families, however, in Helena at that time that did not want to institutionalize their children, and my parents were among them. They worked together, and my parents said, we want Peggy to be a part of our family. We want her to be a part of this community that they so loved. So together, these families work together as advocates for those with special needs. Peggy was in the very first special ed class here in Helena, which was a long time ago, as you can imagine, in the 50s. Because of that, my parents knew that they had to advocate and work with others to continue to provide community services for those with special needs. My father was instrumental in starting Special Olympics here in Helena. He also, at the time when Peggy was finishing her public education, the decision again what to do next. And my father worked with community members to help start Helena Industries here in Helena, which is a sheltered workshop. Peggy was in that first class of employees at Helena Industries. And what that did for all of those people was provided work. It provided them with a sense of dignity, with a sense that they belong to a community, that they are important to. And through the years, we've watched the community services improve and increase to help continue to provide that dignity to those who need that. When Helena Industries closed, Peggy was lucky enough to be able to get hired at Westmont. When my parents were aging, my husband and I talked with them and said that we would take Peggy and have her live with us when they were no longer able to do so. My father died in 2001, my mother in 2002. And so Peggy moved in with my husband and I in 2002. She lived with us and our 3 children for 17 years, and I was her guardian and her primary caregiver. In 2019, I was a teacher and I was offered the wonderful incentive to retire by the school district, and I took that opportunity because at that time, our 3 children are living out of town, none of them in Helena, and we wanted to be able to travel to see them. And I knew that would be very difficult because it would be hard on Peggy. She wouldn't be able to travel with us. And I was faced with a decision, something that I never wanted to do. I know my parents didn't want to do, but it was a decision to move Peggy into a group home. So after a lot of support from family and friends, I started investigating, and we were able to find a group home here in Helena for Peggy. She has been there since 2019, and it has provided that opportunity for my husband and I to have some freedom. I'm still with her regularly. We talk on the phone every day. She's just a part of our family, as she always has been. What we're faced with as we see the funding decrease in Medicaid is a revolving door at the group home. We have so many different people coming in. At the rate that they're paying, they don't stay and aren't as qualified to work with that population. It's a difficult population, as you all know, to work with. So I'm concerned. I'm afraid that we're going to be facing the same situation. Sir, if you can. Okay. The same situation as many of those families that had family members living in nursing homes that had to close. The same is probably going to have to happen if we don't continue to fund Medicaid fully, because we're going to be faced with that decision also. This population has had to trust on others their whole lives to take care of them. And now I'm asking the legislature they are going to fully trust you to do what's right, and that is to fully fund Medicaid. Thank you.
Thank you, Casey. The next speaker is Bella Nyman. Bella was the champion child for 2019 and 2020, representing Shodair Children's Hospital and the Children's Miracle Network, which supports children's hospitals across North America. Bella served as Montanans' champion child and also was selected as one of 10 national champions, the only one of the 10 representing a behavioral health hospital. Please welcome Bella.
Thank you, Mary. I stand before you today as part of the percentage of Montana youth who has attempted suicide. I have struggled with my mental health from a very young age and still struggle at times as an adult. I would not be standing before you today if I had not had access to life-saving community services. Services such as outpatient psychotherapy, occupational therapy, inpatient acute and residential treatment, and psychiatric medication management services. There are many things in my day-to-day life that I never thought I would be able to do. Many things that some of you may take for granted, such as drive a car, live on my own, or work a full-time job. There were times when I struggled so much I did not think I would graduate high school, but I was lucky enough to have gotten into the Project for Alternative Learning in Helena, where I was given unconditional support to succeed. I am a success story because I had access to these types of services and had a team of people who cared about me, from teachers, family, friends, and providers. But I urge you to walk out of this room today thinking of the youth in our community who do not have access to these types of services. I urge you to think of those who slip through the cracks. As a society, we like to question why our youth drop out of school, why our youth fall into lifelong habits of substance misuse, and why our youth are dying by suicide. But I would encourage you to instead question what more we can be doing to support our youth. What more can we be doing to help our youth not only succeed, but thrive? Access to life-saving community services helped me become a happy, healthy, and successful adult, and we have the ability to give those same services to others. We can prevent our youth from falling between the cracks. We can help our youth survive.
Thank you, Bella. And again, thank you to everyone that's here today. Thank you so much for your support. It feels so good to have these people behind me and people in front of me. We've completely filled the rotunda, and I love it. Thank you. Consider this. The #1 cause of death for children 10 to 24 is suicide. We have waiting lists for community services, waiting lists for in-home care for senior citizens and people with physical disabilities, cradle to grave. That means babies and children too. Waiting lists for children who have developmental disabilities, waiting lists for adults who have developmental disabilities. We have nursing homes closing down, 11 already, displacing nearly 1,000 people, people who have to move across the state and sometimes move multiple times when they should be enjoying being cared for by family and friends and neighbors who are familiar to them. And I can't help but think this lack of services leads to a decline in health and even death. Children are in crisis and being sent out of state as Montana's group homes have been closing their doors. We have workforce shortages that lead to an inconsistency in care and a lack of trust. Because there are people being left alone because their worker doesn't show up and sleeping in their wheelchairs. I want to say right now to all of these folks, you are not invisible and we are here to support you. As I said, this is a tragic and unnecessary situation in Montana. It is immoral. Let's do the moral thing and seize this opportunity when we have the money to take care of those who care for us, to take care of the health and well-being and the supports that people need. Thank you for being here, and thanks to the brave people who spoke and everyone who is standing behind me and in front of me. If you have any questions or if you'd like to talk to anybody, please stick around and do. Thank you very much.